Now that you've seen how health insurance works for the individual and for the public's health, how would you answer these questions? Do healthy members of society have a responsibility to support unhealthy members of society? Does it make a difference if an illness is caused by a person's own unhealthy behavior? Do you have a responsibility to purchase health insurance to ensure that you and others won't be a burden to the medical system if you get sick or injured and can't pay? Is it fair for the government to mandate that you and other young adults purchase health insurance you believe you don't need or can't afford? Though ACA doesn't extend access to care for all, it has improved access to care for millions of Americans. It also reformed and improved health insurance. Insurers used to deny coverage for people with pre-existing health conditions, for example, people already sick with cancer or heart disease. Obviously, the sick are more expensive to insure, and insurers were able to get away with excluding them from coverage. Insurers also had a practice of placing annual or lifetime limits on coverage. That means that those with chronic illnesses could quickly use up their annual or lifetime quotas. The ACA put an end to these discriminatory practices that benefited the insurance industry only. The ACA also established minimum standards so that insurance companies could no longer sell subprime policies. It limited out-of-pocket spending over and above what insurance normally paid. And most important to public health, it encouraged the public to make greater use of preventive services by eliminating copays that quickly add up. That means that preventive screenings such as mammograms, colonoscopies, and HIV tests and preventive treatments such as flu shots are covered at no cost to the patient. The Affordable Care Act was signed into law in 2010 and has been implemented over the past 4 years. However, from the very start and right up to the present, the constitutionality of the ACA has been challenged by conservative states that would like to have it repealed. In 2011, 26 states asked the U.S. Supreme Court to consider the constitutionality of 2 major provisions of the law: the individual mandate that, as we learned, requires individuals to have health insurance, and Medicaid expansion in all the states to cover a greater percentage of poor people. The Supreme Court upheld the constitutionality of the individual mandate as a fair and equitable tax. That is, it's Americans' shared responsibility. But it said that requiring states to expand Medicaid was too coercive and that the provision had to be made voluntary. Congress gave the states a big incentive to expand Medicaid. It would pay 100% of the state's costs from 2014 to 2016, gradually reducing federal payments to 90% by 2020 and after. Though this is a generous subsidy, conservative states refused it, and only now some are reconsidering due to pressure from hospitals that need the business. As you'll recall, states were expected to run their own health exchanges or marketplaces. But in 2014, only 14 of the more progressive states ran their own. The federal government had to step in to create a federal marketplace for people in states that refused to comply. Using the distinction between state and federal marketplaces, in 2014, conservatives brought another lawsuit for the U.S. Supreme Court to decide. This time, plaintiffs tried to kill the federal subsidies that help millions of Americans afford health insurance. They cited the language of the law. Subsidies will be provided for those who qualify and purchase insurance through exchanges established by the state. They claim that the law does not mandate subsidies for people in the 36 states that use the federal exchange. The court has not yet rendered its decision. If the Supreme Court decides that the subsidies are not required in those states, and if subsidies do dry up, all but the sickest customers will probably drop their coverage. However, the governors and legislatures in those states will be under pressure from hospitals and the insurance industry to keep a good thing going. Supporters of the law say this lawsuit is another partisan attempt to undermine the Affordable Care Act. So what's the future of the ACA? In the midterm elections, the U.S. Senate ceded control to Republicans, handing both houses of Congress to the GOP. The GOP will try to kill the law. With the presidential election coming up in 2016, we're sure to hear much debate from both parties' candidates on the value and future of the ACA. Stay tuned. It's been a little over a year since ACA was fully implemented. So how are we doing? ACA has not resulted in a government takeover of healthcare as opponents warned. In fact, business has benefited. The law has brought new customers to insurers, new paying patients to hospitals, and new prescription drug purchasers to the pharmaceutical industry. The public has definitely benefited. With more aggressive outreach by insurers and fewer glitches with the online marketplace, enrollment has been higher than the anticipated 9 million. Enrollment has reached 11 million subscribers. Medicaid expansion has helped enormously, as about half of all new enrollees are now receiving Medicaid. As enrollment continues to increase, the question arises, will there be a sufficient number of doctors to handle the new load? Another goal of the ACA was, as its name suggests, affordability. Government programs and subsidies have helped millions of people, but the lower and middle classes bear the burden of paying private insurance premiums. So far, premiums for most people have not risen sharply, as critics of ACA predicted. Some premiums rose modestly, but with competition growing among insurance companies hoping to attract customers, prices should come down. The overarching problem, however, has been the expensive medical technology and services our healthcare system offers, and our inability to say enough is enough. Managed care means controlling the utilization of services to reduce costs. Since managed care isn't popular in the U.S., healthcare costs have been rising faster than the rest of the economy, especially inflation and wages. Actually, the rise in healthcare costs has begun to slow down, but the slowdown began during the 2008 recession, before ACA was enacted. It's a little hard to say how much cost containment can be contributed to the new law. Of course, as we previously learned, ACA has cut down on waste and duplication of services. In the near future, ACA may actually contribute to increased healthcare spending, as more uninsured people are absorbed into the system. A better test of cost containment will have to wait a few years until enrollment has reached its peak, and prevention services have had a chance to demonstrate system savings. The system still has challenges to face and improvements to make. Access, quality of service, and cost vary from region to region within a state and also from state to state. In some marketplaces, insurers don't offer a large enough choice of doctors and hospitals within their networks. The law is still in its infancy, and it has plenty of kinks to work out. Will politics give it the chance? While the Affordable Care Act will never give us universal health care, it is helping to close the gap in care. How do you feel the medical system and the Affordable Care Act are doing in serving the public's health?